one down in Fairfield County, and then the one that I'm leading in Northern Connecticut in the greater Hartford area. We welcome people of all stripes. It's a very open organization. You don't have to have gone to HBS or even Harvard to participate in our events. So I encourage everybody to stay in touch, and I'd love to see you at future events. This event is going to be moderated by Chuck Wolfe. He's to my left in the Hollywood Squares. I've known Chuck for a while. He's been a member of the club, and I know he's going to be a fantastic moderator tonight. I'd like to tell you some things about him from some prepared remarks. Charles Wolfe is CEO of Charles J. Wolfe Associates, a leadership consulting company. Chuck works with leaders, helping them use emotional intelligence to generate positive culture, engagement, and trust. Chuck's work in organization behavior in Harvard's executive programs and his strategic alliance with Yale President Peter Salovey and his colleagues led to his Emotion Roadmap, a creative process that enhances people's emotional intelligence abilities. Chuck is a coach, speaker, consultant, trainer for prestigious clients like Yale University, Disney, Microsoft, the US Navy, Marriott, Kaiser Permanente, Aetna, and UTC. In 2018, the International Coaching Federation selected Chuck as the expert to write about coaching and emotions. In 2019, Chuck worked as a faculty member for Dan Goleman's coaching certification program. Chuck is an active member of the Consortium for Research on Emotional Intelligence, and he has done interviews with many other experts, including members of this panel. As a volunteer, Chuck has created and hosts a public radio talk show on the Emotion Roadmap, a show that helps and teaches listeners to manage emotions and relationships. Chuck serves on the advisory and training boards for the International Congress of Emotional Intelligence. And most importantly, Chuck has helped us organize this panel tonight. Thank you very much, Chuck.
Thanks very much. I wanted to just simply say that I'm interested in tonight's conversation in part because of something similar to what Dan Goleman wrote about very recently. If you haven't seen it, Dan wrote about what we still to get wrong about emotional intelligence in a Harvard Business Review article recently. And one of the concerns I had, if you read the description, is that we basically have a very narrow definition of what we think emotional intelligence is. Many people simply think it's being nice to another person, it's being respectful, it's being tactful, it's being thoughtful, it's being empathic when somebody's had a loss of some kind. And it's all of those things, but it's so much more. And we've always had an interest in emotions. The emotions associated with love, with power, with justice, with conflict, with influence, family, work, community, nation, they're all well known to us. But actually how emotional intelligence plays a role in how we respond and behave, that's not so clear. And I hope to make that much more clear tonight with the panelists that I've gathered together tonight. Colleagues and friends, we have with us Carrie Chernus, Helen Reese, and Richard Boyatzis, all who are members of what's called the Consortium for Research on Emotional Intelligence in Organizations. And Carrie was a co-founder of that organization with Dan Goleman. We'll say a little bit more about that a little later on. But as we get ready, I just want to mention that we've been talking about emotions for a long time, even as early as Aristotle. And I'd just like to read, this is a quote that Aristotle is known to have said: "Anybody can become angry, it is easy. But to be angry with the right person and to the right degree and at the right time and for the right purpose and in the right way, that is not within everybody's power and is not easy." So even as early as Aristotle, people were writing about emotions. But in the 1990, there was two psychologists, one is Peter Salovey, who's now Yale president, and his colleague and friend Jack Mayer, a University of New Hampshire psychologist and professor there. They discovered that we have what they called emotional abilities. So when we say what Aristotle said about anger, it's possible that some people can be angry with the right person in the right way at the right time because they're more skilled at it. They have more ability than somebody else. What these authors said, Salovey and Mayer, was that there are emotional abilities, the ability to identify, use, and understand emotions. And they wrote about it. But it wasn't really popularized until Dan Goleman wrote his book in 1995 called Emotional Intelligence. And as a subtitle, it said why it might matter more than IQ. And at the time, it got a lot of attention because for those of you that might have read the book or heard about it, there was a book called The Bell Curve, written by a psychologist and a political commentator. And it was a very controversial book, and it was very tough to read because it basically said, if you don't have a high IQ, you're not going to do well in life. And here was Dan Goleman talking about what, in some ways, Peter and Jack had discovered, but other things he had learned and written about as well. And so because the bell curve was out there saying IQ is all that's important or most important, and Dan's saying, oh, wait a minute, there's another intelligence out there that might be more important. It got some attention at that time, got a lot of attention, in fact. But it also wasn't just because the bell curve was out there, it was because Dan's a really good writer. And Dan captured the world's imagination with his book. And a lot of people got really excited about that. And then from there, a lot of things started to happen. But even with most new ideas, when a new idea emerges, it's often popular for 1 to 5 years, maybe even 10. Remember, that was 1995. 1995. And now we're in 2021. And we're still talking about it. Not only we're talking about it, but interest is soaring. And why is that the case? In a forum I belong to, I just recently joined on Facebook, just called Emotional Intelligence. Someone asked the question, so if I get better at emotional intelligence, what will be different? That was a great question, so I started to answer it. I said, well, you'll be better at parenting, you'll be better at leadership, you'll be a better teammate. And then as I started to write, I couldn't stop. You'll be better at relationships, at conflict, at decision-making, at strategy. I mean, really, it's almost, what wouldn't you be better at if you were more in control of your own emotions and you understood the things that you do and the things that you say and how it impacts other people's emotions? How could you not be better at almost everything, really? And so I've brought this panel together to help us to explore what this is all about. And I'll say a little bit about each one of them as we get to some of the things that they're going to talk about. One of the things that I'll tell you about Carey Chernis is that he's just written a book. I just finished it for last year. It was published, called Leading with Feeling. And he uncovered through a series of interviews and research with a colleague of his, 9 strategies for how people lead. And he didn't go in telling people that I'm going to interview you about emotional intelligence, but he can tell you more about it. But he did go in and ask, tell me about emotionally challenging situations you might have faced and how you dealt with them. And he teased out some really interesting strategies. And for Helen Reese, one of the things that she's done is she's done a world of wonderful research in the area of empathy. And again, just as a separate standalone subject, empathy is also trending. So many people want to know so much more about empathy. And I think Helen's one of the world's greatest authorities on empathy. And she actually has shown some actual research that demonstrates that patients get better. There are better patient outcomes when healthcare professionals and practitioners are more skilled at empathy. And Richard Boyatzis, well known for his early work in the field of competencies, and then worked and partnered with Dan Goleman to write the Emotional and Social Competency Inventory to measure emotional and social competencies. But Richard also wrote a book recently called Helping People Change that has this wonderful idea about how to coach others with compassion instead of coaching them for compliance. And he'll share that in some of his really wonderful ideas around intentional change theory. And for myself, I'll be talking to you about the emotion roadmap, which is this idea that all of us can become better, no matter what our skill levels are, at dealing more effectively with other people's emotions, being able to influence and motivate other people more effectively, and also to have more inner peace because we're able to control more and manage our own emotions more ourselves. And I've asked each of them to tell you a little bit more about their work when they talk about their work, about how you can find out more, because tonight we won't have enough time to talk a lot in depth about any of these ideas, but I hope it encourages everybody that's on this call with us to want to learn more, to want to do more, become better at emotional intelligence and improve in the ways you can. The world's in a tough place, as all of you know, for lots of reasons. and some pretty unusual reasons, but still lots of challenges, and we're facing them all the time, really. We've had challenges throughout the world history, but I think the better we become more adept at emotional intelligence, the better we'll be able to respond to those challenges. So let me go to Carrie Chernis first. I want to introduce Carrie, and I want to just say a little bit about Carrie. I want to read you a little bit about Carrie. And in talking about Carrie, again, I thought about Carrie's work is with leaders, and he's done a lot of things really, and I'll tell you about that in a minute. But in terms of an anecdote to share about some of my work with leaders, I want to tell you about a woman named Masha, who is a senior vice president in a large insurance company, and I was asked to work with for a compliance issue. She was having a rough time with some of her relationships with people who did the support work, the backroom work for a sales organization that she was in charge of. I actually assessed her. There are assessments that measure emotional intelligence, and one of those assessments is called the Mesquite. That's the Mayer Salve Caruso Emotional Intelligence Test, and found that she was actually very skilled in her emotional abilities. She had high levels of intellectual empathy, understanding why emotions happen. She had really high levels of emotional empathy, felt what other people felt. But over time, as I gained her trust, I realized that she felt that the people in the backroom operation that didn't report to her, she wanted to report to her. And so she was cold and demanding, but she wasn't very friendly, even though she had the potential, and actually in her sales organization was known for really warm and effective relationship skills. Once I was able to work with her and help her to understand how important it might be to be able to use those relationship skills with her workforce, she actually decided that she would go to her peer who she had some struggles with, didn't like, but asked if it would be okay if she started to meet with the support teams. And the woman said, sure, sounds like a good idea. And over time, she developed a wonderful relationship with the support teams, actually got friendly with the peer who had been a challenge before, and within a year's time was promoted to president. So my point is that you can learn how to use your emotional intelligence skills, even if it doesn't always come naturally. And now I want to introduce Carrie, who's going to tell you about some of the things he discovered when people are gifted with this already. So let me read you a little bit about Carrie Chernis. Carrie is a PhD and emeritus professor of applied psychology at Rutgers University and co-chair of the Consortium for Research on Emotional Intelligence in Organizations. He specializes in the areas of emotional intelligence, work stress and burnout, leadership in organizations, and planned organizational change. He has published over 60 scholarly articles and book chapters, as well as 8 books, including The Emotionally Intelligent Workplace with Dan Goleman, Promoting Emotional Intelligence in Organizations, Guidelines for Practitioners with Mitchell Adler, and The Human Side of Corporate Competitiveness with Daniel Fishman. His most recent book that was published is Leading with Feeling, 9 Strategies for Emotionally Intelligent Leaders with Cornelia Roach. Dr. Chernis also has consulted with many organizations in both the public and private sectors, including American Express, Johnson & Johnson, AT&T, and the United States Office of Personnel Management. So Carrie, you're up.
Thanks, Chuck. That was a wonderful introduction, not only to the panel, but also, I think, for the concept of emotional intelligence in general. So what I'd like to do is to take a couple of minutes to clarify what we mean by emotional intelligence, and then talk a little bit about what the research says about the relationship between emotional intelligence and leadership effectiveness, and then finish up sharing with you a couple of things that we learned from the research that Chuck just described. So in terms of emotional intelligence, I think Chuck did a good job of describing what it is. The textbook definition of emotional intelligence is that it's the ability to accurately perceive, understand, and manage our own emotions and those of others. Again, the ability to perceive, understand, and manage our own emotions and those of others. So let me give you an example of one of the leaders that we studied, a situation that she described to us, which I think really illustrates what emotional intelligence is all about. She is and was the CEO of a medium-sized engineering and architectural consulting firm. And the firm had been going through some very hard times. They had laid off people for the first time in the history of the firm. And so for a number of weeks, when she met each Friday with her leadership team, the news was pretty much uniformly bad. And then one week, she noticed a change. One of the team members, I guess it was the chief financial officer, gave a report that was actually pretty promising. But when he finished, the group almost immediately was ready to move on to another topic. And when she realized that they were not going to talk about, this wonderful news, she said, "Wait a second, you guys, this is really wonderful. This is the first good news we've had in weeks. Let's stop and take a couple of minutes to, talk about why things seem to be looking up." And so that's what they did. And as they were talking about, what they had done to make things start to improve, the whole emotional atmosphere really began to lift. And when they moved on to the next topic, that positive climate continued. And at the end of the meeting, when the team left that room, they were feeling much better about the way things were going. And we know from research on emotional contagion that within a very short period of time, that more positive outlook spread through the entire organization. So what does this have to do with emotional intelligence? Well, first of all, she was using one of the strategies that we identified in our research, and I'll talk more about the research in a minute. And that was, she was almost continually monitoring the emotional climate of the meeting. And so when the group was moving on to the next topic without any discernible change in the emotional climate, the CEO understood that this was really a lost opportunity, and that she really should do something to try and get them to go back and talk about the good news. And so that's what she did very skillfully. She said, "Hey, wait a second, let's talk more about that." So those are the three basic dimensions of emotional intelligence: the ability to accurately perceive emotions, to understand the dynamics, and then to use your emotional intelligence skills to manage and often change those emotions. Okay, so that's what emotional intelligence is. And that particular incident, it seemed to have a very positive effect on the organization, at least in terms of motivation. But I know a lot of you, like us, are primarily interested in, and have to be primarily interested in, the bottom line. So what do we know about the relationship between emotional intelligence and leadership and organizational effectiveness? Well, it turns out, I like to think in part because of the work of the consortium during the last 25 years, that there has been really a ton of research that's appeared, which shows pretty convincingly that there's a positive relationship between emotional intelligence and leadership effectiveness. And I could spend the whole evening talking about the various studies, but what I want to do is just briefly describe one, which I think really, for me at least, kind of nails it. This is a study that was done a few years ago. I think it appeared in one of our referee journals in 2018. A group of researchers were interested in looking at all the research that had been done up to that point on the relationship between leadership effectiveness in different kinds of organizations and emotional intelligence. Was there really a positive relationship? Did more emotionally intelligent leaders have more effective, were they more effective as leaders? Were their organizations more effective? So as they were going through these studies, they were able to identify 12 different studies that independently looked at the relationship between a leader's emotional intelligence and not the leader's effectiveness, but the effectiveness of the leader's subordinates, their performance. And the question was, did the subordinates perform more effectively if they had a more emotionally intelligent leader? And they used a technique that many of you are probably familiar with called meta-analysis to statistically pool the results. And what they found, as I said, there were 12 studies. When you pooled them, there were over 2,700 leaders involved in the analysis. And they found that, in fact, there was a very positive relationship between the leader's emotional intelligence and the performance of the people that leader supervised. In fact, when they looked at the data more closely, they found that the leader's emotional intelligence accounted for about 23% of the variance in employee performance. And that is really huge. I mean, when you think about all the different factors that contribute to an employee's performance in an organization, previous experience and where they, were trained, and maybe even IQ a little bit, to have the leader's emotional intelligence contribute to almost a quarter of the variation. That, I think, is very powerful evidence for how important emotional intelligence is. So let me very briefly tell you a little bit about the research we did. As I said, there was a lot of research, and there's still more research accumulating on the relationship between emotional intelligence and leadership effectiveness. And what I was interested in several years ago was a very different question, which I think is just as important, if not more important, for practitioners, for leaders. And that was, how do outstanding leaders use their emotional intelligence to get these very positive results? So we asked a small group of executive coaches, management consultants, to identify outstanding leaders who were not only outstanding, but also were seemed to be very effective in managing and using their emotions and those of others. And we ended up with a group of 25 mid-level and senior level executives, evenly divided between men and women, and very diverse in terms of the different kinds of organizations they came from. And we used a technique, an interview technique called a modified behavioral event interview, where we asked them at the beginning of each interview to think of some situation, some incidents in which they had to use and manage their emotions and the emotions of other people in order to accomplish their goals. And in the end, we ended up with 126 of these incidents. And as we were poring over the data and analyzing the data, what eventually emerged were these 9 strategies that Chuck referred to before, and that we mentioned in the title of our book. So let me just describe one of those incidents to you, which I think highlights a couple of those strategies. By the way, the first strategy is monitoring the emotional climate. A lot of the leaders we studied did this quite a bit, in fact, almost continuously. And the example I started with is an example of a leader using that strategy. But in this second example, we were interviewing the president of a wholesale beverage company and beverage distributor. And he described a situation in which he was having a very difficult time working with one of their major customers. He would meet with the major customers every year to renegotiate the contract. And he had done that several times with this individual. And somehow, every time the president of the company got so flustered and upset and agitated that, you know, by the end, he came away with a really bad contract. This guy knew all the buttons to push. And so he was getting ready for his next visit and not looking forward to it, needless to say. And he was having lunch with one of his friends. This was an older executive who had really become kind of a mentor and coach to him. And he was describing what he had to do the next week, and asked, you know, this other guy, do you have any suggestions? And the guy said, well, why do you always have to be the one to go? Well, why don't you ask one of your people to go in your place and let them deal with this guy and negotiate the contract? So that's what he did. And when the guy came back, it was by far the best contract they ever had with this customer. That incident, as I said, illustrated two more of our 9 strategies. The first one, and the one that frankly surprised us the most, is that he sought out help from other people. Now, the reason that was surprising is because these were the experts. These were 25 outstanding leaders, emotionally intelligent leaders. And yet here was one of them saying, you know, what I did in this situation that made the difference was reaching out to a coach. And he really helped me. The other strategy he illustrated was modifying the interpersonal boundary as a way of managing emotions. You know, a lot of the leaders we interviewed, and I know a lot of you who are listening to this, have good strategies, sort of internal cognitive strategies for managing your emotions. And he was using those, he had those. But no matter what he did, trying to, you know, tell himself this isn't the end of the world, or, you know, I can really handle this, or it didn't work. Well, another strategy that many of the leaders used was to change the interpersonal boundary. In this case, what he did was to create an interpersonal boundary that was really rigid and that involved having another person totally go and interact with this customer and negotiate the boundary. So those are some examples of the kinds of incidents that we came up with in the book and the strategies that we emerged with. So I think I'm about out of time. Are you keeping track of the time,
That's about right, Carrie. But Carrie, could you just tell people how they might access your book if they wanted to get a copy of the book? And also about the consortium website?
Absolutely.
Another place that they can learn?
I will do that. Those are the 2 best resources I can think of at this point. The consortium website is eiconsortium.org. EI Consortium is one word. And there are a lot of resources on that site. And if we have more time later on and someone's interested, I can talk a little bit more about the consortium and what that is. As far as the book goes, the title, as Chuck mentioned before, is Leading with Feeling, 9 Strategies of Emotionally Intelligent Leadership, published by Oxford. You can get it from Amazon. My co-author is Cornelia Roach. If you just, type in the title or just type in Chernis and Roach, you'll get to it right away through your search engine.
Thanks, Carrie. Thanks a lot, and thanks for giving some concrete examples of how that works. I think the way you uncovered those strategies, for anybody that's a leader out there, I highly recommend taking a look at that book for understanding the things that you're already doing, for one, and also to see other ideas that may help you be even a better leader. I want to talk and move to Helen Reese now, and as I mentioned, Helen is sort of one of the world's best researchers and probably the expert on empathy these days. And she's got a very rich background, which I'll read in a minute. But because she practices in healthcare and she's a psychiatrist, and I'll tell you more about her in a moment, I just wanted to say a little bit about another really interesting footnote or sort of an aside about emotional intelligence is, again, most of us think emotional intelligence is about relationships, but it's also about objects. And you don't often think about that as another part of the model of emotional intelligence is to think about emotion in objects. And let me give you a concrete example of how that has an impact also. So at one point I was working with a number of hospitals, and one of them was St. Elizabeth's, which is in Brighton, Massachusetts. And St. Elizabeth's Hospital had a general manager who came in to take over the reins of that hospital from the hospitality, the hotel industry. And he had this concept that he felt that people who come to a hospital and see a hospital setting are really fearful. They come in afraid. They're very anxious, fearful that they might never go home. And so one of the things that he wanted to do was he wanted to change the way people felt when they came into St. Elizabeth's. And because of his hospitality industry background, he decided, I want to make the lobby look like a fancy, luxurious hotel where people are coming to go on a short vacation. And so he worked with architects and he worked with designers, and he actually went about changing the face of that lobby. And so the lobby doesn't look like most hotel lobbies. Now, I don't know if there's any research to support this notion that that had a different outcome on patients. But I do know, and if you're interested, you can write to me and I'll send you a copy of the chapter I wrote for the International Coaching Federation on how successful coaches influence feelings, thoughts, and behaviors. Because if you believe and understand how feelings do influence your self-talk and influence your behaviors, then people coming into St. Elizabeth's, feelings were going to change just by their environment and the emotion in those objects. So let me tell you about Helen, who really knows about healthcare and about empathy. Helen Reese, Dr. Reese is a psychiatrist and associate professor of psychiatry at Harvard Medical School. She directs the empathy program at Massachusetts General Hospital. In 2012, Dr. Reese founded empathetics.com, an organization that provides evidence-based empathy and communication skills training for healthcare, law enforcement, business, and education. Dr. Reese appears regularly on podcasts and programs on the topic of empathy and emotional intelligence. Her TEDx talk, The Power of Empathy, TEDx, has been viewed nearly 600,000 times. Her new book, The Empathy Effect, has been licensed in 10 foreign countries and translated into Korean, Polish, and Italian, and an audiobook. Dr. Reese and her teams are dedicated to transforming organizational systems into compassionate care systems. Her research has been published in leading medical journals, and she has won numerous awards. And I would just add that she is also one of the most empathetic people I know. So Helen, you're up next.
Chuck, thank you for that really lovely introduction. I especially liked the last thing you said. We're together this evening because we're talking about why emotional intelligence is needed now more than ever. I think we can all agree that we are living in very strange times where the rules of how we connect have completely changed. Piling on to extreme political tension, racial and economic inequality that's roiling our country, the COVID-19 pandemic has brought about changes in how everyone connects at home, at work, and at play. Many business leaders and sociologists agree that even when the pandemic is finally under control, and we're hoping that will be sooner than later, that our work and home lives will never go back to the way they were just 1 year ago. The barriers to connecting because of social distance, working from home, and relying on virtual platforms has led to new norms and new challenges. As a clinical psychiatrist and empathy researcher, I was struck by the number of my patients who were reporting that they felt that their doctors really didn't care and weren't that interested in whether they followed their guidelines or not. And about 10 years ago, this was a resounding theme that led me to really question, is a lack of empathy actually harming our patients? Because people were forgetting about their weight loss programs, they were unmotivated to continue to try to stop smoking. And this sense of people not connecting and not caring was really having profound effects on my patients. And so I wanted to answer the question, are we beating empathy out of doctors because of the new time constraints, the productivity requirements, the electronic health record that has them looking at computer screens more than their patients? And if we can beat this quality out of people, can we actually put it back in? Can we upregulate what we're down-regulating? So this led to taking time off to do a neuroscience fellowship in the study of empathy, where that topic was just exploding in the neuroscience literature. And my goal was to see whether, if we understood how the brain worked with empathy, whether there were ways that we could actually train doctors and nurses to reconnect in meaningful ways. So this project took many years, but it ultimately led to conducting a randomized control trial at Mass General Hospital in 6 different specialties, where we trained a randomized selection of 100 physicians who were sorted by computer as to whether they would get the training or not. And we asked patients to rate the doctors before any training took place, and then again after the training period. And with a brief intervention, we got significantly higher patient ratings of physician empathy and compassion. Now, this is important on every level, most importantly because it also connects with healthcare outcomes. And my team at MGH also conducted a systematic review and a meta-analysis of every randomized controlled trial that claimed that just manipulating relationship factors, connection, empathy, and things like goal setting, did that actually correlate to improved health outcomes? And it turns out that it did. In 13 very rigorous studies, we found that purely relationship-oriented training led to improvements in obesity, pulmonary infections, asthma, medically unexplained illnesses, and hypertension and diabetes. So if people think we're just talking about how to be nice just to be a little nicer, as Chuck started our program, we're talking about something way more important. And our research group also were interested in, did we just get improvement in patient ratings of warmth and kindness? What about competence? So we conducted another study with over 1,000 analog patients, showing them videos of empathetic care versus detached care. And we had them rate those videos on warmth and competence. And we found that by showing empathy, you increase ratings of physician and nurse competence, not just whether they're warm and friendly. So it really is a key driver to embedding trust in the relationship, which leads to better adherence to medical recommendations. So what exactly is empathy? We use this term all the time, and it's not just being nice. It's really not just one thing. It's actually a capacity. It's a human capacity that enables us to perceive the suffering of others, to process that perception, and it motivates a response. Now, we know that every time we're moved by something that is troubling, or where somebody's in trouble, we don't always act. So empathy is a motivator, and whether we act or not is the demonstration of compassion. Empathy is really at the cornerstone of all 4 quadrants of emotional intelligence. which includes self-awareness, other awareness, self-management, and relationship management. But empathy is most necessary for awareness of other people's emotions. Without empathy, the ability to assess the emotions of others just remains a cold observation of another person's emotions without any full human engagement. The risk is that people are regarded more as objects or as functions to carry out their jobs, and less as living, breathing humans who join together to form larger living organisms that is their workplace or their social place. Empathy is not just about feeling warm and kind. It has both emotional and cognitive components. We have emotional empathy when we're moved by other people's suffering, when we hear that someone has a child who's very sick or a parent who is on their deathbed. We are moved to offer help or to show interest or say a kind word. So empathy, we're hardwired for this capacity because it connects us in a connected fabric of human experience. But there are challenges to empathy. When employees miss deadlines or show up late or use a snarky tone, it's easy to be put off and move to judgment, frustration, and anger. This is where emotional intelligence, curiosity, and cognitive empathy come in. Cognitive empathy is also called perspective taking. And it just means getting the perspective of others, and it means removing your own eyeglasses. And so you're not just looking through your lens, but you actually put somebody else's glasses on and try to see the world from their point of view. At this time, when employees are not interacting or even seeing one another on a regular basis, when we only have half of a masked face to connect with, and work lives have been challenged by childcare and other responsibilities, it's more important than ever to broaden the aperture through which we view other people. Instead of a healthcare example, I thought I would share an example of how empathy imbues emotional intelligence from a coachee that I've been working with. I have disguised the names and actually all of the particulars of the incident, but I think you'll see the relevance of how empathy enters into emotional intelligence. So at around 8:30 one night, I got a surprise call from a man that I'm coaching called Bill. He called my cell phone and he was very apologetic about the time of night and didn't want to bother me, but he said he was extremely triggered by an email from a person at his level who he had asked for some help on a very complicated new coding system. And the response was, just go figure it out yourself. And saying, I don't have time for hand-holding these people anymore, or for you for that matter. So this was really triggering, because this behavior from this man called Jack had been going on for at least 6 months. And Bill was getting coached to try to learn how to really increase self-management and how to work with emotional triggers. So he was very, very motivated to send a retort email back because he was so angry at the continued disrespect. And his normal confidant wasn't available, or he probably would have just vented and gotten to a similar place. But he knew that sending any email right then could be dangerous. So I was happy that he called, because what he really first needed was self-empathy. He needed his own upset and frustration at this bad treatment to be understood to be validated, where he could calm down and know that his reaction was normal. So when people are very emotionally upset, instead of telling them what to do, first we have to listen and really listen for validating why they're upset. Once that happens, the emotional valence really drops. And one of the great lessons that I try to pass on is never engage in any kind of email exchange when you're emotionally triggered. And never get into anything after 8:30 at night, because it usually never goes well. And then both people often have a sleepless night. So the first thing we did was just really emphasize how important it was not to respond. And that actually took some pressure off, because the need to respond and to get it just right kind of went away, knowing it could wait till the morning. So Bill knew he was triggered and he wanted to act, but he was showing self-awareness enough to make a call, knowing he had all this emotional intensity that needed to be dissipated. So venting is a terrific way to calm ourselves down before we engage with someone with whom we're in conflict. So after the self-empathy and sort of calming down and feeling validated, he was open to some perspective taking. So I asked him to take off his eyeglasses and start seeing what was going on through Jack's point of view. And he said, I know he's really overloaded. A member of his team just quit and he's responsible for getting out a whole new product. I said, is there anything else going on? And he said, well, he's mentioned a few times that he's having marital trouble because there's a huge difference in how he and his wife are handling the COVID restrictions. I can personally attest to the fact that when a couple is not in alignment about how to handle mask wearing, washing, and also social restrictions, it's a very, very fraught situation. So when Bill finished talking about Jack, he said, you know, maybe this isn't about me at all. And so this is a really important point. When we are the target of really offensive, disrespectful, sometimes very charged up behavior, it's really hard not to take it personally. But what we are experiencing is how that person reacts to being emotionally overloaded. And it's probably what they do in any situation. It's not that personal. And one way to think about it is like getting mail that's addressed to occupant. Everyone's getting the same mail. It doesn't matter what your name is or where you live. That same piece of mail is going to everybody. And once we realize that we're just getting the target of, we're the target of how that person reacts in a triggered situation, it's much easier not to take it personally. But it also doesn't mean that we then excuse it and let it go. So the next day, Bill called Jack and asked him, just how are you doing? So instead of sending a nasty email, he actually showed interest and curiosity. He listened to what Jack said, he empathized, and when Jack was finished, Bill calmly said that his emails were coming across in a way that was disrespectful and distracting from the work they were both trying to get done. Jack apologized, and they agreed to bring the problem of his overloaded schedule to the company manager. Bill had moved from judgment and resentment to compassion for Jack. So I'm going to just conclude by saying that the COVID pandemic has frayed most people's nerves to some extent. Emotional intelligence requires that we factor that into how we understand people's behaviors and think about how to help to support ourselves and others. Simple things like making eye contact. So I noticed when Carrie was speaking, he looked like he was looking at us, but it actually means we have to look at the camera instead of looking down. So we can train ourselves to toggle between looking at the camera and maybe looking at our screen if we're sharing a screen, to remember that people love that target of being seen. And so we can incorporate that into our practices. We can really make the most of emotion expression through the eyes. It turns out that the eyes are much more authentic in expressing our emotions than our smiles, because we can all fake smiles, but it's very hard to fake like the true happiness that you get when it's a genuine smile. So there's a lot of reading we can look for in whether people's eyes are downcast, whether they're lit up, whether they're sparkling. So we have these tools, and my book, The Empathy Effect, it is, the byline is 7 neuroscience-based keys to transform the way we live, love, work, and connect across differences. And I explain in the book these 7 keys for how we can really augment the ways we connect with others. We are at a time when we are needing to recognize that when we catch negative emotions from others, we need to step back and try to understand what's happening. It will help us connect rather than separate us from people that we need to work with and live with. And it will help to make a very challenging period one that we can all learn and grow from. Thank you.
Thanks very much, Helen. Appreciate it. Richard, we're going to talk about you next. I got a quick story that I got to tell, and then put Richard up. And you probably have to unmute yourself, Richard. So when I was a few years ago, I was working in in Albany for Kaiser Permanente. It's a very large health maintenance organization, some of you may know. And it had an operation at the time in Albany, in the Albany area in New York. And the IT group was working to include a new health maintenance organization that Kaiser had bought, and they were trying to merge the systems, and all the people were working. You've probably seen information technology workers do this at times. They were working 7 days a week, really long hours. They were kind of very stressed, but they were challenged by the work, and they liked the work, and they liked the operation, and they really liked Gary, the fellow that was leading it, but he could see that burnout was around the corner. And so one of the things he said, you know what, I'm gonna have to take a day, and I'd like to spend that day with them trying to understand what they'd like to feel, what their future might look like, if we can create the kind of workplace where they're going to really be happy. And I'd like, Chuck, your help in doing this. And so when I came in, I worked with them to help to create a vision. And the thing that they looked at and that they said that was unique, so I've done a lot of vision work. And one of the things that they said that was unique was we want to work in a place where we, our teammates, our leaders, all of our employees, and our families, they use the word flourish. And I'd never seen the word flourish in the workplace before, and I'd never seen it quite used like this. And then they started to describe what it looked like if they would be flourishing, because they weren't flourishing at the time that they thought this. And all of a sudden, you could see the change in tone and the excitement that came as they started to think about the intentional change they want to make, and that leads me to Richard. This was, at least to me, a way of thinking about some of the work that I had done that sort of lent itself to, when I read your work, Richard, some of the thoughts that I had. So Richard Boyatzis is Distinguished University Professor of Case Western Reserve University, Professor in the Departments of Organizational Behavior, Psychology, and Cognitive Science, and H.R. Horvitz Professor of Family Business. He is a BS in Aeronautics and Astronomics from MIT, a MS and PhD in Social Psychology from Harvard University. Using his intentional change theory, he studies sustained desired change of individuals, teams, organizations, communities, and countries since 1967. He is the author of more than 200 articles and 9 books on leadership, competencies, emotional intelligence, competency development, coaching, neuroscience, and management education, including the international bestseller, Primal Leadership with Daniel Goleman and Annie McKee, and the recent Helping People Change with Melvin Smith and Ellen Van Oisten. His Coursera MOOCs, including Inspiring Leadership Through Emotional Intelligence, has over 1 million enrolled from 215 countries, which is just amazing, I think. He's fellow of the Association of Psychological Science, the Society of International and Organizational Psychology, and the American Psychological Association. And about Richard, I would also say he is great company. He's a lot of fun, and he's really fun. It's been really a wonderful opportunity to get to know and learn from you, Richard. So I'm glad you could be here, and now you're up.
Thank you very much, Chuck. It's really hard following Helen and Carrie. I remember once I was doing a keynote at an annual meeting of the UN Food Program directors in Dublin. And, we had all the discussions beforehand about what I was going to talk about in my keynote and some exercises I was going to run. And it wasn't until I showed up in Dublin that I found out who was preceding. And I was talking about people being inspirational leaders and all this, only to discover that the person who was speaking before me was Nelson Mandela. So it was, it's like that moment. I feel humbled. But at any rate, my exploration of this all started in my 6.5-month career of designing interplanetary vehicles, because that's what I studied to do. And that's how long I lasted at Northrop Norair in California doing this kind of research. Because what I discovered was managers were really inept at getting people interested, excited, or able to do something. If I jump ahead to 1970, I did the first competency study in which we looked at outstanding performers versus modest or average performers versus poor performers. And with Dave McClelland and two people from PDI, Marv Dennett and Rob Silzer, and a consultant, Pat McLagan, I guess the five of us are usually seen as the people who created the competency movement in human resources. But the key was that I was asked as, one of the more junior folks of the group, small group of us, to tackle this thing of explaining why some of these, in this first study was on supervisory chaplains in the Navy, why some of them were outstanding in their impact and others just couldn't get off the ground. And that led to a lot of these studies, always anchored on performance effectiveness. I've been a part personally of hundreds of these at my former company, McBurr, which then was merged with the Hay Group and now Korn Ferry, and colleagues at other universities around the world, and Carrie among them. We've done probably several thousand of these studies in almost every country of the world. And one of the things I want to start with is the observation that 70 to 80% of the people in management and leadership positions, from sales branch managers to CEOs of public, private, and nonprofit organizations, aren't adding value. They can be taken out of that managerial or leadership role, and the organization would function more smoothly. Now, I'm saying this as the teaser because before I close my comments, I'm going to give you 3 things that you could be doing if you're not already. Some of you may be, but 3 things you could be doing to dramatically increase the impact you're having on having your organization innovate and produce. But it starts with this notion that when we would look at the outstanding versus average, whether we're looking at in big companies, and some of our early companies we looked at did a lot of studies for General Electric and American Express and even Digital Equipment in the 70s. But they also included various groups in the US Navy and Marine Corps, State Department, and a lot of organizations in other countries and other governments. It became very clear that the majority of these behaviors, these competencies, which are sets of behaviors with an underlying intent, really had to do with how people were either managing themselves or managing their relationships. And when my first book on the data from 12 of these large organizations came out in 1982, I remember Howard Gardner had one of his books, his main introduction of the multiple intelligence, came out about the same year. Maybe it was exactly 82. And I remember talking to Howard about it because he had this thing where 2 of the intelligences, one was intrapersonal, how somebody was managing themselves. and one was interpersonal. And I was very struck by that. I also, by the way, really liked one of the intelligences he had, which was kinetic. Decades later, my parents are immigrants from Greece. I spoke English is actually my second language, and but in my youth, I was quite conversational, but I lost it. So in the 90s, I wanted to get back to speaking Greek. So I started studying it every time I'd go to the health club at Case Western and working out. And I did 45 minutes on the Stairmaster as a part of my routine. So, you know, I'd be listening to tapes, speaking the thing, reading pieces. And it doesn't strike me how powerful kinetic intelligence was until my wife and I were in the island of Rhodes and in this one area called Lindos, going to this temple, which is way at the top of a hill. And I forgot something. I put one of the camera bags down and I forgot it. And I said, whoops, you know, and I ran and grabbed the camera bag. I found it and I ran back up the stairs to where my wife was waiting. And she said something to me. I answered her in fluent Greek. And she said, whoa, it was because I was running upstairs. Anyway, back to Howard Gardner. It led to the realization that the vast majority of these capabilities, although there are always certain critical thinking, cognitive competencies, 80 to 90% of all the competencies that differentiate performance were either about the self or about the relationships. And it's one of the reasons why when, you know, Dan's book came out in 95, Dan and I were in our PhD program together and we were close personal friends as well as in our classes together. But I remember him at the time calling me and saying, hey, you're the one who's actually doing this research and you've got the training. Let's make it work. So I think emotional intelligence is really two different things. There's how you're handling your own emotions, but there's also how you're handling the emotions of others in the terms of relationships. Now, I'm not going to say much more about emotional intelligence or social intelligence. You know, Helen has explained empathy in more ways than most normal people will ever really grasp. And a lot of the other things you understand. You understand what adaptability is, emotional self-control. You understand what influence is, or being inspirational. What I want to do is what I've been spending a lot of my time on. I mean, I still do research on the emotional and social intelligence and the methodological work and all that kind of stuff, but it's really in the use of it that I think most of us have an interest. And that's where my work in the last 20 or 22 years has really focused on how do people use it, not just in leadership, because that was almost a duh. You know, as John Cotter said back in the 80s, people at the head of an organization manage people who 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 actually do the work. And that means that, you know, anybody with half a brain realizes that as soon as you're in a top executive position, you're not managing a budget, you're not managing a strategic plan, you're not managing any of those things. You're managing people who are enacting, creating, or doing all of this. So the central theme that I really turned to in, even though I did my thesis on unconscious drives on intimacy back in the early 70s, what I'm going to talk about today is where my work in the last 22 years is focused on, which is how do you motivate others? How do you help people be open to learning and change? And I think that right now, the engagement, pre-COVID, the engagement crisis everywhere in the world is telling us that we have a huge motivation crisis. People just don't want to continually use their capabilities. And that's where we really can shine. But it's going to take some things that are a bit counterintuitive. Before I get into the arguments about what that would do, let me just say, I don't want to spend a lot of time talking about the research because you can read about it either in cursory terms in English, or you could, you know, get copies of the things. But what I'm about to talk about is based on 39 published longitudinal behavior change studies, 3 fMRI studies we've done, and 2 hormonal studies. So we're looking at both what produces sustainable change in people's behavior, and we're focusing on emotional and social intelligence behaviors, and what is the internal mechanism, what's going on in people's minds and bodies that enables it. So before we look at that, let's do a little exercise. How can we do a whole hour and a half on emotional intelligence and not do something with emotions? So here's the exercise. I want you to think, get a piece of paper out if it helps, and a writing implement. I want you to think about who has helped you the most in your life become who you are or get to where you are. Who are the people who you would say, I wouldn't be who I am today if it wasn't for X and Y. I wouldn't be where I am today if it wasn't for person Z. Just give yourself a moment, write down a few names. It's hard to interrupt the list you're generating, but because we're time constrained, go back to the first person you thought of and remember a moment in which you learned something important from them. Now, I mean, if it was a mother or father, there would have been hundreds, if not thousands of these, but let your memory filter to one that'll jump out and replay the video in your head briefly. What did they say or do? How did it make you feel? Just see if you can do that for the first person on your list. I'll go silent for a while and let you reflect on that. Now, normally, I would give people more time on this, and I would have people break up in pairs or trios and talk about this. We don't have the space or the time. But let me say the question I want to ask, and I can't, we don't have a mechanism for me to actually hear from you in this case, but is to answer the question, how did it feel remembering these people, writing down their names, thinking of a moment? How did it feel right now in doing that? Now, I know it's dramatic. Only a few of you have your videos on live, but it was interesting to me that almost half of the people whose videos are on screen were smiling when they were doing this. So either you were reading something funny or it was the memories. Sandra, you're nodding your head, suggesting the exercise. And I think Lois, you did too, and Will. I've done this exercise in all 7 continents, about 65 countries, and it doesn't matter where we're in Astana, Kazakhstan, or Milano, or Cleveland. People will often say, well, I felt really grateful. I felt like somebody loved me. I felt honored, respected, seen. And it was very, very moving, very humbling to me. Sometimes people will say, I felt really nostalgic, by code for word for sad, because the person's passed away and they miss them. People will say, I felt excited and lifted, or I felt centered. And part of the magic of this is that if you had any of those feelings, not all, any of those, you spend a few moments in the parasympathetic nervous system, which, by the way, is the only physiological system that allows you to combat the ravages of chronic annoying stress. So, one question for you to think about later tonight and maybe tomorrow: whose list will you be on? That's our legacy, folks. I mean, there's 2 ways to have a legacy in life. One, you can donate a lot of money to a really great university, like Harvard, or you can really have key relationships. Of course, I'm joking, and as a professor, I'm paid to say the first thing. But so this is what we've been studying. What we've been studying is how people typically help others. Remember, I told you that's how I got into the field of psychology. I was absolutely frustrated with these. I was in a group of scientists at Northrop. We were all working on spaceships in 1966 and 67. It was kind of like two departments of Sheldon's, if you follow Big Bang Theory. And I couldn't believe how inept the managers were, in terms of getting ideas from us and getting us excited about what we were doing. I mean, it contrasted with a project manager I had at MIT in September of 1964, who got me involved as a freshman in working on calibrating lasers for the navigation system of the Lunar Excursion Module. That guy was phenomenal at really getting us excited about what we were doing. So what we began to discover is that most of the time when we try to help someone, whether as a manager or as a leader, as a teacher, as a physician, as a nurse, as a parent, we actually spend more of our time trying to get them to do something we want them to do. And Melvin Smith and I started writing about this in 2002. And we said, this is really coaching for compliance. You want this other person, and usually it's out of good intentions, but you want them to do what you want them to do. And what we started to discover is that when you do that, you always activate the body's stress response, the sympathetic nervous system. You make people defensive. It could be mild, could be extreme, and you very often become a helping bully. When people use their emotional and social intelligence, they engage people at a whole different level. And we've been calling this coaching with compassion. We use compassion not in the sense that Helen was using. We actually use the Confucian interpretation of feeling for others in pain, as Helen suggested, as part of empathy, but also feeling for others in joy. So it's people who have a problem and people who want to grow. It actually, I like to say it comes from Aristotle, but truth be told, Confucius wrote about it 200 years earlier. So although I usually like to claim most good ideas came from the Greeks, this is one case where I think it came from the Chinese before they created the COVID virus. So here we are. Sorry, I'm just joking around. I don't do Twitter, and you could see why. I'd be crucified all the time if I did. But the reality is, when we compare people who excite others, who open them up, who create organizations that come up with innovative products after innovative products. Bill Gates and Ballmer were horrible CEOs of Microsoft. I've had this validated by VPs of HR at Microsoft. They were brilliant, and certainly Bill Gates is a phenomenal philanthropist, but they were horrible executive leaders because they used to crucify people whenever they came in with ideas because they would critique it. Nadella is turning Microsoft on. They're more innovative in the last 2 years, 3 years, than they had been in the 20 or 30 years before that, I think. So the magic is, how do you open people up? Well, we call this coaching with compassion. And the idea is you have a stress response in your body, which is a hormonal system, sympathetic, and you have the parasympathetic. When you activate the parasympathetic, people are open to new ideas and other people. Under a stress response, everybody, every gender, every race, every ethnicity, under stress, people are cognitively, emotionally, and perceptually impaired, period, because we have too much of it. And I'm even talking about too much of annoying stress, not the less, today where everybody is, as Helen was talking about and Carrie was talking about, I mean, everybody today is under a lot of acute stress as well as annoying stress. And then if you're in a leadership position, you have power stress. So here we have this dichotomy. On top of that, we also know that neurologically, there are some major networks in the brain that we use all the time. One of them is the analytic that you use to solve problems or analyze something or make a decision. And another one is called the empathic network by Tony Jack. It's really historically called the default mode network. And that's a network where you're scanning the environment, open to new ideas, and by the way, open to other people. The problem is these two networks suppress each other. They're antagonistic. So I finally had, from about 2006 to 3 years ago, in the studies I was doing, the neuroimaging studies, but then others that Tony Jack was doing, got evidence for why I'd been saying since the 70s, show me a leader who starts a meeting with financials and I'll show you an ineffective leader. I mean, look, financials are important. I built and ran 2 consulting companies for 11 years with several hundred geeky PhDs in them, but I also, you know, I like money. You know, I mean, I don't like to spend it. I like to make it more. It's just kind of a game thing. But the idea is, I'm not dissing financials. I'm dissing the fact that a lot of executives think it's motivating to talk about numbers. So here are a couple revelations. The most important thing you can do with a group of people, if you want to motivate them to be open and to use their capability to really want to be there, is to focus on the dream, the vision, the sense of purpose, the shared vision, not goals. Some of my research published in 1972 empirical studies showed that goal setting was important for behavior change. In the 90s, it became clear to me that that wasn't working too well. By 15 years ago, I then had the data to show why. When you spend time trying to motivate people with specific goals, more dashboards, and all this kind of stuff, you continually activate what I call the negative emotional attractor, which is this analytic network in the brain, and it closes people down. I mean, they've shown that the peripheral vision of people under this activation goes from 180 degrees, which is what most of us have peripheral vision, down to about 30 degrees. People stop scanning the environment. You have what's called competition neglect in the strategy field. All of these things go on when you focus on goals and objectives and dashboards, thinking you're motivating people, when what you're really doing is making everybody feel guilty and defensive. Now, goals have a place in resource acquisition, but except for salespeople and people high in the unconscious drive of need for achievement in terms of McClellan's things, everybody else is turned off to specific goals. And it's one of the things that makes a lot of things that we try go awry, especially in leadership and management. Second, you want to create a balance between these two attractors, the positive and negative. You need the analytic, you need the empathic networks in the brain. You have to make decisions, you have to solve problems, but you have to be open to ideas and people. You need the stress. If you didn't have stress, you wouldn't have stayed awake this long, assuming those of you with just your name on the screen are. But you need the parasympathetic nervous system to rebuild your body, literally allowing stem cells in your brain to become new neurons. You need the balance, and to learn the balance, you don't do both at the same time, because all of these systems in our bodies are antagonistic. So what you have to learn is a facility for moving back and forth for yourself first. And that's why an article that we just had published is called Thrive and Survive, How to Manage This Balance of Personal Sustainability. But as Chuck was explaining in part of his example, it's also, how do you stimulate that in others? How do you help others learn to go back and forth? And then how do you build quality of relationships? All of this about emotional and social intelligence is for naught if you can't convert it into relationships. And, you know, folks working with me, a lot of doctoral students for the past 13, 14 years have been focusing on the properties of shared vision, shared compassion and caring, and shared energy. And we've got data, I think there's 37 or 38 doctoral dissertations showing family business success financially, innovation, development of family business leaders, bank executives, better treatment adherence in terms of type 2 diabetics, if the physicians establish these relationships, and IT managers, even engineers. They don't have to be managers. So a huge amount of data saying the quality of the relationships really matters. And if you're more philosophical or like the classics, although I enjoyed reading his work, especially Italiano, is Niccolo Machiavelli really was not a good model for what we need and want in this day and age. Cicero had a much better insight to that. We want to be loved. We want to be cared for. We want to care for others. And as a result, I think that if we focus on the dreams and then the goals later, dreams being shared purpose. If we focus on the balance of back and forth, it's one of the things that people sometimes, you could use it through mindfulness work. You could do it through caring for others and helping people less fortunate, especially the elderly, especially elderly professors. It's important that you help elderly professors. You can do it through hope, and you can do it through playfulness. So there are a lot of techniques for the balance, and then building these caring relationships and spending the energy to invest in the relationships. And then you'll find magic happens.
All right, Richard, thank you very much. Hey, listen, this is, I hope you've all enjoyed this. I know we're supposed to run till 7:30 and we're going to try and have some time for questions. I do want to just, first of all, thank Richard and Helen and Carrie and Alex for, allowing us to put this on for you. I hope you've gotten some real value. Again, these are some of the, I think, some of the smartest people out there about this different areas and aspects of this field of emotional intelligence. I hope it's broadened your view. One of the things I'd like to say, I was going to spend a few minutes just talking about this concept I call an emotion roadmap. It was in the late 1990s. I had the chance to work with Peter Salovey, again, he's president of Yale at this point. At that time, he was chairman of the psychology department, and Jack Mayer and David Caruso. And the three of them actually looked at this ability-based model, and they were trying to understand how do they make it operational and practical and useful. And one of the things that I've discovered over the years that I've been working with people is that when smart people are stuck, when really good critical thinkers and problem solvers that usually have no issues at all solving problems can't solve a problem, what I've found is it's almost always something emotional is happening inside, either you and or the other persons that you're dealing with. And if you think about your own situations, if there's any place in your life right now where you're stuck personally, where you can't decide how to move forward, you're feeling uncertain, confused, concerned maybe about escalation, if it's something that involves conflict, if you're really stuck, it's almost always something emotional is happening. And when I worked with Peter and Jack and David, it seemed to me one of the things I could do was use another Greek. The Socratic method showed up in my head. It was like, I needed to turn this into a series of questions. And I thought maybe the questions are, what is it you're feeling? And if the feelings, as I came to understand, drive your thoughts and behaviors, if your feelings aren't helpful, then what would be ideal to feel? And if you are not feeling what's ideal to feel for what you're trying to achieve, what you're trying to get done, what would be ideal? And how do you get from, let's say, feeling anxious to feeling confident? How do you do that? How does that happen? And so I spent a lot of years working in that field in that way. And I know we're out of time pretty much, and I want to allow just a few questions if we have time. So I'm going to stop. I will say this, though. I want to talk about at least one leader that I work with who really seemed to get this right from the start. One of the things that he does as a leader, and I think this is a really good example, is that he's always interested in new information. In fact, I talked to him tonight and shared a really interesting idea around how you create an intervention for diversity and inclusion. Actually came from our consortium. This one of our other members talked about it. But one of the things that I wanted to say about him was I wanted to let him know about a new study that had come out of the Cornell Hotel Management School that was about what it takes for really high-level resorts to generate premium profits with guests and the kind of loyalty. It's almost like evangelical loyalty where people just you can't believe the place I just went to. It's such a wonderful place to stay or to eat or to be entertained. And it was welcome, comfortable, and important. Those were the emotions that show up when you go to a hotel yourself. If you feel welcome and you are made to feel comfortable and you feel like everybody there thinks of you as important and you're treated that way, you want to come back, is what the research showed. And when I went to show that to him and talk to him about using this research with his people, he said, you know, Chuck, that's a great idea, but let me, instead of focusing on the guest component, let's do this when we teach about it with internal groupings of bellmen, of house people, housekeeping people, of the front desk, of financial people, of the human resource team. Let's bring them in their respective groups and ask them, do they feel welcome, comfortable, and important? Because he was someone who knew that if you have your staff, when your staff deals with guests in a frontline way, as most hotel people do, and they're feeling welcome, comfortable, important, that's what your guest satisfaction scores are going to show. And he's an award-winning manager and leader in that industry. His name's John Caparella. If you want to know more about the work that I do, you can go to my website, emotionroadmap.com, and see a lot of information. You can also go to the eiconsortium.org website and see the interviews I've done with Richard about his book, and Helen about an earlier book, and Carrie about his more recent book, and also some of the other interviews. And I'd encourage you, if you're interested in emotional intelligence from a parenting and a school perspective, one of our colleagues is a fellow named Mark Brackett. Mark's a friend, and I started off when he first started in schools doing the work he's doing that's called Ruler. He's the director of the Yale Center for Emotional Intelligence. And Mark is offering a free book club. You got to buy his book, I guess, and read his book, Permission to Feel, which is also on the website, an interview with Mark about his book. It's a great book, but you can join with Mark. It's starting January 21. Just go to markbrackett.com. That's another way to learn about parenting and dealing with children. So let me just ask if anybody has any questions, you can put them in the chat room. And if there are, I'll take one or two as best I can before we close out. I see some chats, but they're not questions, just thanks. You're welcome. It's been such a pleasure to do this. And I think, we're right pretty much at the end. And so I don't know, Alex, are you there? And if you want to say just some closing words, you can jump in at this point. I want to thank everybody again for showing up, being part of this. And we're probably going to publish this recording on YouTube. So if you think other people may want to see it, I'll send a link to Alex and he can send it out. Or you can email me directly. I'm at cjwolfe@cjwolfe.com. Richard, you're on mute if you want to say something else.
This is Alex.
Oh, okay.
I'd just like to say thank you to everybody who joined us tonight. And of course, thank you to Chuck and all of the panelists. We really appreciate your participation and your insights. I will echo some of the comments I'm seeing in the chat, which is we have a lot of reading to do, and it may break my nightstand from all the extra weight of books that I now have to put there to read up on all these different subjects. But I learned a lot, and to Chuck's first point, I think it's opened up our eyes to all of these various avenues that we can now pursue to expand our knowledge around emotional intelligence. And I'm really excited about continuing this journey. On behalf of the HBS Club of Connecticut, thank you everyone for joining. I encourage you to check out the resources of our panelists, and I will be following up with an email and links to these various resources.
Thanks, Alex. Somebody did ask one question. They asked, is self-awareness the foundation? I'd say self-awareness gets you to the point where you're aware, but then you got to do something about it. And Richard, you want to say something? You got something real quick you want to say? Huh. Go ahead.
Anxiety is what drives the stress response. It's one of the many things that does. And really good levels of emotional intelligence or social intelligence enable you to ameliorate it through the parasympathetic nervous system. So they really are quite opposite. But the question of, is self-awareness the path to emotional intelligence and social intelligence? Yes, but not always. and Dan Goldman and I kind of disagree on this a little bit. I mean, he feels that self-awareness is always the starting point. I think it's very useful for certain people, but I have now realized there are a whole bunch of us out there who either don't have the learning style or tolerance to spend time, or the lack of defensiveness to look inside. But when we care for others, when we stop and try to work with others and take care of them or motivate them, we very often can use that as well to a path to more emotional and social intelligence. So I actually think there's two different ways to get to it. I think Helen would agree with me if you.
Thanks, Richard. Maybe I just add this, and then we should close, I guess, because it's 7:30. I just add that one of the things that Dan Goldman said in our consortium meeting a while back, and at first it hit me a little funny. It was empathic concern. It was this idea that if you, empathy is like you have this cognitive empathy, you know why people feel a certain way, and emotional empathy, you feel what other people feel. And it doesn't really matter unless you're concerned about how other people feel. And so that really rung a note with me. Helen, did you want to say something? Go ahead.
Well, our brain is wired, I'm echoing here, but that when we perceive these emotions in other people, it acts to motivate empathic concern. That is the loop that comes out. And then we decide, are we going to act with compassion? So empathic concern is completely wired into our perception of other people's suffering. If we have the capacity for affective empathy, and we realize not everybody does.
Thanks, Helen. And Carrie, would you like to say something before we close here?
Yeah, I just sort of finishing up the discussion about empathy and empathic concern. The strategy that the outstanding leaders that we studied used most often to try and activate their empathy was to put themselves in the other's shoes. So that's an example of a strategy which even people who are very high in empathy sometimes find can be very helpful in order to activate that empathy, because sometimes it's not always so easy. And we're seeing that, I think, a lot in the recent week or two in this country.
Well, thanks everyone. Again, thank the panelists, and it's fun to see people that I've seen, recognize old friends and recent colleagues. And Lois, say hello to your mother. James, I'm glad you could make it. Sarah, thank you for the kind note in the chat room. And Len, hope you enjoyed it. And Deborah, thank you for your kind note as well. So everybody, thanks so much for joining us. It's been a really lovely time. I'm going to sign off now and say goodbye and good night. And thanks again for being here. And I'll put it out on YouTube. If you want to know how to get a link to it, you can contact me at cjwolfe@cjwolfe.com. Take care, everybody. Bye-bye.